HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. The Florina Rusi Marke Comprehensive Breast Center has all you need to determine your risk factors, plus a wide variety of treatments for breast cancer. Dr. Mehran Habibi discusses the importance of early screenings and the positives of being close to home. Give it a listen.
Hey Staten Island, welcome to HealthWish. I'm here at the Stone House at Clove Lakes, one of Bread and Butter Hospitality's premier locations. What an incredible setting. And I'm here with Dr. Mehran Habibi, our Director of Breast Surgery for the Western Region and for Staten Island University Hospital. Welcome.
Thank you. Glad to be here. Such a beautiful place.
Yeah, can you believe you're in Staten Island?
Very, very nice. I like it a lot.
Tell everybody a little bit about yourself. You've had a very long career as a breast surgeon, done some really amazing things, been at or attended some of the most prestigious institutions in the country. Tell us a little about your path and how did you end up sitting here?
Sure. So I grew up in Tehran, Iran, did the medical school there, did the residency and fellowship in the States, in Pennsylvania and VCU in Virginia. Then I joined Hopkins, been there for around 15, 16 years. As a faculty, did a lot of research, clinical care and all that. And when I came and saw the Staten Island, fell in love with it. And I saw the huge opportunity to really build a fantastic program as well and to serve the community. And I'm very excited to be here.
We're really excited to have you here.
Thank you so much.
And breast cancer in some ways hasn't changed at all, and in other ways we've learned so much about it in the last few years. What are the new things that you would want the community to know about breast cancer?
Absolutely. So you're very, very correct. There are some elements of it that has been really unchanged for years and years, yes. And you can look at it from every angle that you look. We had tremendous improvements. From the screening programs, and the quality of mammographies have changed significantly just in the past several years even. From the analog machines that they would take the film pictures to digital, and then now to 3D mammography, which is like a state-of-the-art, great quality views. So those are all from the screening point of view. From surgical techniques and point of views, again, surgery is an old art and old skill, yet we had significant improvement with minimally invasive surgeries by preserving as much as we can on the breast and yet removing all the cancer tissues. We have really improved the quality of the technique. And then when it goes to the adjuvant therapies, to therapies after the surgeries, including chemotherapies or hormone therapies, have been a tremendous amount of progress and improvement in it to narrow the therapy to the ones that they really need it and spare the one that they don't. And when it comes to the radiation, also same thing. We really narrow the field to the areas that we really need to target the radiation and spare the rest of the body. So improvement all along in every angle of it has been in the past generation, if you would, and the past several years.
And yet certain things haven't changed, right? I mean, I can tell you as an ED physician, one of the worst things was when somebody would come in complaining of something and you would know right away that there was an advanced case of some kind of cancer. There was this horrible sense of, my gosh, if only. So there is an if only here, right? Without screening, you're going to miss certain things. Can you just highlight again what the importance of screening is and what's the current recommendation?
Absolutely. As a general recommendation, the screening is for folks without any problems or any issues with the breast. It starts at the age 40. We recommend to do an annual mammographies every other year, but I think if folks can do the annual mammography, I think is better. And that would be the screening program that will essentially look for if there's anything happen. However, if somebody has problem with the breast, or if they feel something, those would change completely. So in any age, if somebody feels something with the breast, that would be the time that you seek the care and we do the appropriate test. If somebody has a family history of breast cancer or ovarian cancer in an earlier age, we start the screening even earlier, up to like 30s, even 20s. It depends on the family history. And it's been established in the States for the past 30 years, has been very effective. The compliance is more than 70%, and we are really able to detect a lot of cancers in an earlier stages. But you're correct. We do have, even as of now, referral from the emergency room that the folks come with a neglected tumors that have been there, and they said, oh, hopefully it's going to go away and get better on its own. And unfortunately, it doesn't. And sometimes it turns into large tumors. So it becomes much more difficult to treat afterwards. Something that can be very easily treated with a small resection or the hormone pills afterwards, it ends up needing to do the chemotherapies or needing to do major resections and reconstructions to just be able to control that situation. So that, I think, is very, very important, to the point that you mentioned about the screening. And if there is something that they feel, I think seeking care is absolutely the best thing to do, because we have great amount of tests from the mammographies, ultrasound, MRIs, all those for the different folks that depending on what they need, and they can make a diagnosis very early.
We share something in common. We both love math. And I have always had such a passion for keeping people in their own community for their health care. And you did a little math equation to talk about what are the implications time-wise and possibly money-wise about seeking your full cancer care going into a different borough. Would you want to share that with us?
Absolutely, yes. So of course, in the cancer field, we always encourage doing a second opinion or seeking opinion from others. That's completely, great. The problem with seeking the entire care, like somewhere outside the area that you live, you have to take into consideration the amount of travel that you're going to do. So the breast cancer, it's really a multidisciplinary care. So it's not only that you're going to have that resected and that would be done. For your surgery, you're going to have several visits of the pre-op, post-ops, and the imaging that you need to do. These can last several months, 5 months, 6 months. So you have to travel back and forth. After that, you have radiation. That happens also over several weeks that you have to go back and forth. So I did the back of a napkin, calculation for one average breast cancer patient that wants to, when you look at the entire number of the visits that they can go back and forth, it would take somewhere between 60 to 90 visits to complete the care. And if you look at the cost of toll, the cost of the gas that you're going to do, the parking, just the basic cost that you have to do, never mind the cost of the time that you have to spend hours to go, is somewhere between $15,000 to around $18,000 for just the matter of the transportation and all that, which is quite significant. Few people really put that into the calculation of when you seek the care, especially when we have centers like Staten Island University Hospital that we provide the state-of-the-art, the most advanced care that anywhere in the world can anyone get. We provide it here, from the research portfolios to the most advanced care, reconstructions, and the adjuvant therapies, all can be done in their neighborhood. And that's what actually attracted me a lot to Staten Island, because we can provide the care here in their neighborhood.
Join us next time as we continue the conversation. HealthWish wishes to thank our special guests, Dr. Brahim Ardolic and Dr. Mehran Habibi, recorded at the Stonehouse at Clove Lakes. For more information, please visit the link in the video description. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.